Thank you so much. I am so incredibly excited to be here, and that amazing bio left something out that I thought was incredibly important, and then I'm presenting here, which I worked 16 years in a retail setting in a toy store. Okay? So your clients, they came to where I worked all the time and loved it. So, and one of the things that was a frequent question when I first began working in the 1990s was, where did we stock the toy boxes? And we're like, there aren't toy boxes anymore. See, kids have too many toys these days. It's called toy systems. So think IKEA with lots of bins, okay? And just like toys no longer will fit in a box, your medical records will no longer fit in a file. We have grown beyond that. Just if we indicate and utilize clinical results, traditional stuff you'd find with electronic medical record, not even involving genomics and social history, there's still too much unless you involve an electronic medical record system that allows us to access that data. So one time during Christmas this past year, because I still help out occasionally at the toy store, even though I do this #1 all the time, I asked my fellow coworkers, I said, okay, if you went to a desert island, you could only bring 4 toys. What toys would you bring? Now look at all these very different answers. And these are toy professionals, okay? They are making some great choices for you. But remember, they are professionals making the choice they would recommend. If I asked the average 5-year-old if this would be their choice, they would probably say no. You see, everyone is individual. Their desires and what they want to play with are unique to them as an individual. Our choices and our suggestions, are great guidance, but we need to keep that in mind. Recently, I got to see Leslie Kelly Hall present an amazing speech about her mother's care. Leslie's very, very involved within the healthcare space and what's going on with electronic medical records. And her mother and her had lots of conversations, but didn't have a conversation about this. See, when her mother went to the care provider who took Medicare patients, she spoke to the receptionist, and the receptionist made it very clear that on this appointment you can only talk about 4 things. So pick your 4, right? Well, Leslie's mother did that and decided the pain in her shoulder wasn't a significant problem, so she wouldn't mention that at multiple appointments until the pain grew too bad and it turned out she had metastasis in her shoulder. That was the pain. And she died soon after. But she had to pick just 4. Think about that. A system that doesn't allow us to talk about the things we need to talk about and what we're truly focused on. You see, for years I worked in a toy store, and one day we had a customer who came in, and she came in to buy that toy, an Ogo Sport Ring. It's an amazing toy. Ted can tell you how amazing that toy is, because we actually played with it on a stage at a medical conference. It was great. We both failed at that, but we learned something about embracing failure. Well, she asked about that toy, and she asked about it because she had an entire list of toys. And I gotta tell you, I looked at this list. It was a $1,000 sale. Yes, right? But when I looked at the list, I realized very quickly every single thing on her list was speech, language, occupational therapy, behavioral awareness type toys. This was a very, very special list. And I asked her, where did you get this list? She said, well, I just got my son tested to go into a private school. He's in preschool now, and they say he failed, that he has scatter, and he has to play with all these toys for a year, and he has to learn how to do better, and then he'll test well. I said, really? Do you know what scatter means? She said, no. I want to ask you a series of questions. When your child was little, did he spin wheels? Like the stroller wheels or the car wheels? Did he have fun with that? And she said, yes. Did he talk early or talk a little bit late? Well, he was a little later. When he was a little younger than he is now, did he want to play with dinosaurs and talk about dinosaurs or trains or bugs or anything all the time? He didn't want to change topic. She said, oh yeah, he's into Thomas the Tank Engine. He just loves that show, and he knows all the trains, and he's got a chart, and he pays attention to what's happening with every character, and he just wants to talk about that. And so I paused. I said, ma'am, do you think maybe your son has autism? And I watched her face break before me. And she said, yes, oh, yes, I do. But nobody talks to me about that. The school doesn't talk to me about that. The doctor doesn't talk to me about that. So that day in a toy store, I hugged a customer. I gave her the conversation she needed to have. And did I sell a bunch of toys? No. But I started her on a care journey that would affect the rest of her life. You see, we have a whole bunch of patients right now that are suffering. See, in the back of their mind, they're playing this game Monopoly. Remember Monopoly? I loved that game as a kid. What I did not love was my brother beating me every single time. You see those red hotels? They destroyed me every time. And in healthcare right now, it's not the red hotel, it's the Giant White Hospital. See, we're scared and we're worried and we don't know how much things cost and we don't know what we're supposed to do and we don't know if we can ask that fifth question. There's this amazing thing called the Adverse Childhood Experience Survey, or ACEs. There's a doctor in San Francisco named Nadine Burke, and she uses it with all her pediatric patients in a low-income setting. And she uses it because Kaiser Permanente and the CDC did this study and determined that individuals had certain things that happened in their childhood would dramatically impact the rest of their life. So if you had abuse in the home, drug use, a parent who was imprisoned, a parent who died, somebody who was mentally ill within the home, your chances of having a heart attack later in life were greatly, greatly higher than that of the rest of society. But yet these questions are not asked. You see, when I was a child, I was abused. I did deal with an abusive household. And the toy box you saw on that first slide, that would be the toy box that was at a flea market, because we resold our toys every single week. And when I was only 12 years of age, I was able to buy a gun at a flea market for my father, who was a felon. And then he threatened me with that gun for the next coming years until finally, even as a child, I grabbed the bravery to call out for help. The bravery that so many patients do not have because they're scared. See, we play a game. We play a game with lives, with children and with their parents. I had a husband. I have 2 wonderful children. We went into the roller coaster that is healthcare today. We went into a system where my husband was seen at 5 facilities without access to electronic medical record, without access to the data. Oops, sorry about that. When we are treated that way, we become scared and we stop trusting people. We start asking so many questions, and we'll ask questions to everybody, and that's what I did. I asked every single question. When my husband was sick and first diagnosed, he was at a facility in which they had an electronic medical record system, but we couldn't see it. An oncologist who went to a medical conference for 4 days and left us in a room without access to information and no understanding of the care situation. I asked everyone I saw what was going on. When the oncologist came back to speak to my husband after his trip, he said to him, "So I understand your wife's been asking questions about this case." And my husband said, "Yes." He said, "Well, if little Miss A-type personality has questions, she needs to come to my office hours." And this is a painting of that day. And everything is true to the moment except for in the reality I had a chair, but emotionally I was kneeling. He never turned the computer screen around so I could see what was going on. He didn't stop answering the phone. He didn't stop talking to the nurses about the parking lot problems or the fact that Miss Rosen had a chemotherapy suite and whether it would be available later that day. And all the while I'm asking questions. He's speaking so rapidly and using these scientific words I just don't understand. So I say, "Please, could you slow down because I've got to research these words online." And he said, "I don't like people who research online." I said, "I'm sorry, but I don't have a background in medicine. My only way to understand you is to look up these words." And he said, "That's right, I'm the one with the medical degree." So if you look at the wall in the background, that's not a diploma on the wall, that's a piece of paper that says, "I have a medical degree." And if you look at the other side, that's a portrait of his family. But if you look in the shadows behind it, that's a portrait of ours. Because this is a moment when a family is being broken apart. All the time my husband was in a hospital, I would go home every night after caregiving, and I would talk to the wonderful concierge in my apartment building. Her name is Valerie Barnes, and she's an amazing woman. And for 23 years, she took care of a son with severe developmental delays. He's had multiple brain surgeries. He goes into a care setting, and I told him of our experiences and told her, "Do not go into that hospital without supervision." Very soon after, her son was found unresponsive in his care setting. And an adult daycare, was sent to the same facility my husband was at. She called her husband in a panic, and he got there as fast as he could. You see, they'd seen the transition between pediatric care and adult care, and they were not happy with what they had seen. When he arrived at the facility, the son was still in the hallway. The EMTs had not completely released the case because nobody was taking over. The father said, "Have you looked in his throat? Is there an obstruction?" They said, "We haven't seen anything." The father went over, pulled his son's jaws open, and pulled a therapy glove out of the child's throat, and probably saved his life. because I had had a conversation with a concierge in an apartment building. See, patients talking to each other and spreading news, that changes lives. What if we could have a report card about hospitals? I never have been treated at George Washington University Medical Center, but I painted this painting about them based on open data sets from hospitalcompare.gov. And if you look at that stormy sky, that's their clinicals, and their clinicals rock. It's like the 90th and 100th percentiles. But if you look at that poor girl with that report card, those are their patient satisfaction scores. And when it comes to patient satisfactions, that facility is getting C's, D's, and F's based on 2010 data. And when I painted this, I painted it in front of the institution on the sidewalk, and everybody walking out talked to me. See, that's the beauty of open data. We begin to communicate. Okay, that's a 20 cue ball. Who's played with the 20 cue ball? It's a toy. It's an amazing toy. You must have played. Oh, see a few hands. Okay, so 20 cue ball is spectacular. It's a toy that's loaded with a mathematical logarithm, autotaxonomy, and a dictionary. So you think of anything in the whole world, and that ball, my goodness, will figure it out, usually within 20 questions. And I gotta tell you, the only reason it doesn't sometimes figure it out is they tweak the code. See, they found human beings don't like to fail, so they like to occasionally win. So the ball itself is designed to let you win. That's technology, okay? So can you imagine a 20 cue ball in medicine that asks things like, do you have night sweats? Do you have blood in your urine? Do you have bone pain? Have you had weight loss? Can you imagine a device like this in triage that asks, do you have kidney cancer? The kind of disease that destroyed my husband. See, technology, it catches zebras. It sees more than the person that's right in front of it. My son went to a clinic appointment in Washington, D.C., and it was amazing. Okay, this is a clinic, a walk-in clinic. And they handed him that netbook, and they said, okay, he was 5. You can start building your electronic medical record. And you know what he started to do? He started to type everything he could. It was wonderful. It was brilliant. And he's only 5, so I started to help him through the process. We asked all kinds of questions to each other, and then we pushed submit, and it went. And then we tried to turn the netbook back into the office, and she said, no. You push submit. It went to us online. So now you can surf the web for the rest of your appointment. So my son was surfing the web, and then finally the doctor saw him and told him about his eye condition and what it meant. And then he Googled his eye condition there in the appointment, showed my son an article from Wikipedia on it. They rocked out and had a wonderful time. My son left that appointment so happy. And then 1 month later, we had a regular pediatric checkup. And at that appointment, the doctor, who was a lovely woman, turned her back, sat at her computer screen, and just randomly asked questions into the air. And my son got the wiggles. He's sitting up there, he's starting to shake. He jumps off the table and walks up to the doctor and says, when's it my turn to type? Okay? See, that's what we're headed toward. Now, you might have noticed me in the back of the room, and you might have noticed the fact I have a painting on my back. And there's a whole bunch of us with paintings on their back. It's called the walking gallery, and the idea being that patients must wear their stories, share their stories to get change. See, my son, who's my eldest, he has autism. And when he was involved in my husband's care, he was just like the eye in a door crack. So I painted him as an eye in a door crack within this really large painting I did. But he is now at a point where he helped me design his own jacket. He said, Mommy, I want you to paint that part in the parking lot at the hospital where they have that thing and they charge you money, and then I want you to put a skull on top of that and put coins in the mouth. Because you shouldn't make a family pay to park when they're visiting their dying father. And my younger son, he painted his own jacket. It's called Feelings, and guess what it's about? It's about his clinic doctor's appointment where they checked his eye, because he said, you know what, that made me feel good. It made me feel important. And so he marches wearing that. I recently started a petition on change.org to encourage Hallmark to create hospice cards. I know I'm a data access advocate, but I'm encouraging paper. I'm encouraging conversation. And why I do this is because this wonderful woman who works at the toy store named Morgan, she was on a trip to Europe when her mother was diagnosed with cancer. And she was told, there were things that could be done and treatments that could happen, and they decided to not tell Morgan to come home as quickly as possible. Because, we don't talk about death in this culture. And we don't always talk about realistically what will happen next. So Morgan did not get to say goodbye to her mother. And I painted that. So we must talk for more than data. We must talk about lives. Right now, if you go to Kaiser Health News and you look at their Facebook page, what will you see is this image, which is the walking gallery in its Lego form. See, I made Lego figures for every single one of us who walk around the world in jackets, because you know we can't get together. We're all over the place. But we can get together in the world of toys. We can get together in something like this that unifies us all. My first jacket for the walking gallery was this image, a giant letter A. For I am Little Miss A-type personality, right? And this style of painting is called painting in negative space. You see, I did not paint truly the letter A. I painted the world around it. You can take a negative and you can turn it into a positive. And if you combine what he's talking about with genomics, with what I'm talking about with social history and patient access, well, you're just going to change the world.